More than 150 years ago, the Sisters of Charity of Leavenworth trekked across the plains to fulfill their calling, a calling to bring a healing ministry to the western frontier. Their determined spirit, mission, and vision lives on. Core to our mission is improving the health of the people and communities we serve, many who are the most vulnerable. Paying attention to what happens inside and outside the walls of our medical facilities is essential to ensuring the overall health of our patients. We convene and support nonprofit partners in the communities we serve to make sure that people, no matter how much money they have, are able to access healthcare, that they have a place to live, and they have enough food to eat. Some call this the continuum of care. We call it our mission, because our mission is you.
At SCL Health, it's our mission to serve the poor and the vulnerable. That's part of why we provide free and low-cost health care to individuals who can't access that kind of care anyplace else. We serve tens of thousands of people in our safety net clinics across Colorado, Montana, and Kansas. It's really the heart of who we are.
Our healthcare system has a lot of gaps in this country. Sometimes the poor and vulnerable experience most of those gaps.
We often say zip code is more important than your DNA in determining your health. It's the social determinants of health, access to housing, access to transportation, and we have the opportunity to partner with them in the journey of overcoming these barriers.
The Caritas Clinic has been around for over 40 years. We provide comprehensive adult primary care services. It's a team of doctors that includes our employed and volunteer faculty along with a team of residents. We see folks anywhere from healthy adults to folks with multiple chronic illnesses.
I was working in the medical field for 5 years, and out of nowhere I just got sick and my whole life changed. No one knew what was wrong with me. By the time they figured it out, I had to be admitted right away. I lost my eyelashes, my eyebrows. I couldn't go home to my kids. My son was 1. By the time I went back home, he wouldn't recognize me. That was one of the biggest struggles that I had, that he forgot about me. I didn't want to come to the emergency room when I was sick because I didn't have insurance. If I didn't have care here, I wouldn't know where to get resources to get medical help.
The families without insurance or individuals without insurance are very much fighting for their lives. They don't have access to basic medications, screening protocols. If something goes wrong, they often will not be able to seek care out of fear for the cost. I met Maria actually in the hospital, and that's one of the great services that this clinic offers. If we identify patients who don't have insurance and would benefit from regular care in the hospital, we're able to follow them across the street here.
Dr. Koppel, she was there since day one. She always made me feel that I was safe here, that she cared about my health. And she would always ask me everything to see if I was okay.
Access to care is vitally intertwined with the health of the community.
Across all our clinics, approximately 50,000 visits happen a year, and the vast majority of those patients are underserved, either uninsured or Medicaid patients.
My experience made me feel welcomed and that they care for my health, and I feel secure to be here.
We try to meet the needs of the patient, provide the care that they need, when they need it, where they need it, and provide a high quality care.
I knew the doctors knew what they were doing, and I really appreciate it.
Access to care is one foundation for the well-being of a community, but it's far from the only one. People need a safe place to live, and is why SCL Health continues to invest and convene partners to help those without stable housing. We've seen that an unsafe or unhealthy home, or the lack of a home altogether, can interfere with individuals' ability to heal from illness or maintain their good health. It's why we continue to work with a broad spectrum of community partners to increase access to affordable, healthy housing in the communities we serve.
Working with our colleagues and our collaborators across the city and the county, we're able to get people into permanent housing provide them the health care and the social services support that they need, and really move them from homelessness to hope.
Homelessness in Butte is really such a complicated thing. There's not enough housing, there's not enough affordable housing.
Three main problems that our folks are facing. Poverty is certainly one of them. Addiction is another, and mental illness usually plays a part somewhere in that person's life.
What is at stake for the poor and vulnerable if no one helps is that really they don't get the support services they need. And in the environment when we live in, there's a lot of cold months out there. People can freeze to death if nobody's there to help them.
It's really hard to do when you don't have that Maslow's hierarchy of needs, the food, water, and shelter. It's really hard to run across town when you're paralyzed in a wheelchair on an icy roads.
Butte, like any other city in our country, is facing huge problems with homelessness. More and more people are losing their houses, they're falling on tough times. So we see a lot of issues within our community where people just do not have a place to go. One of the great things about working at St. James is that we are trying to do a lot of things for homeless people. One, on a day-to-day basis, we provide food for homeless people. Second thing that we're really proud about is that we have partnered with Action Inc. to provide permanent supportive housing.
I'm Drea Jacka, and I've been here in Butte for 6 years. I had a spinal infection in my back, and I was taken to the emergency room. I was paralyzed from the waist down.
Without a support network, they're using systems in our community that are really quite expensive to keep using. What we know about this population is that when you house them permanently and you provide some support services around them, it is more dignified for the person.
We literally go out with peer support and wrap services around these people.
Action Inc. has turned everything around for me and saved my life. This is the first time I took advice from a friend that said, do exactly what they tell you to do, instead of doing your own thing, because doing your own things hasn't got you very far.
St. James is very proud of our mission in that we're here to help the poor and vulnerable. We take care of the whole body. Not only are we taking care of those people with their medical needs, but we take care of people outside the walls of the hospital as well. You know, helping people cope with homelessness and help people cope with a lot of their social determinants that they have as well.
This for me is about humanity and every person being able to have a dignified, decent life. It doesn't matter the color of their skin, what country they came from. None of this matters. Every human being is loved and cared for here.
Having enough nutritious food to eat is an important part of everyone's health and well-being. That is why SCL Health focuses on eliminating hunger in the communities we serve. We are inspired to see the positive impact that can be achieved when organizations come together for a common cause. A great example of this is Meals on Wheels, Mesa County.
SCL Health has sponsored Meals on Wheels since 1989. It's a key piece of our mission integration program. We're not just about big buildings and doctors and nurses and high-tech machines. We're all about people. And Meals on Wheels represents that really well. It's a program that takes food to people that are homebound and hungry. How more vulnerable can you be?
When anything happens in this world, we celebrate or commiserate by sharing food. If somebody passes away, you show up at their door with a pot roast. When you get that big promotion, you all go out and celebrate. I just think it's so important in a community to share food and make sure your neighbors are fed and make sure that your neighbors are okay.
I'm Glenda L. Charlesworth. I was born at the Old St. Mary's Hospital on 11th in Colorado. I weighed 4 pounds, and I've lived here all my life. In 2013, I found out that I had an infection And then I had an infection that went over to my hip, and I had different types of things that went wrong. I dipped into extremely low blood sugar, and I am diabetic. I was gone from home for 6 months, so I made many trips to St. Mary's.
The mission of Meals on Wheels is to provide quality nutritional services for the seniors of Mesa County, Colorado. All of our clients are age 60 plus. The majority of them are homebound.
It's hard to cook for one person, and it's hard to buy fresh fruits and vegetables that will keep because they don't go to the store, and if they did go, it wouldn't be very often. I drive up to the house, I get out of the car. Some of them might put their trash can away or get the mail or newspaper. I go to the door, ring the doorbell, and you can tell they're just right on the other side of the door because it comes open immediately usually. Their faces light up. They're just so happy to see someone and talk to someone and someone new to tell the old stories to.
This past year in 2020, Meals on Wheels served over 160,000 meals. Right now, we're on track to serve over 200,000 meals.
Meals on Wheels have basically come to the front door, and I was in need. And so I've opened the door, and I want to hang on to them because I know how well they've taken care of me.
Sharing food is sharing love, and that's what St. Mary's Meals on Wheels program does every day. We show up with food, we show up with love.
Access to healthcare, stable housing, and the elimination of hunger. These are all foundational pieces in our effort to love and care for the communities we serve. Of course, we focus on top quality healthcare. We also help create dignified life in our communities. Our mission is you.